You've probably often heard things like, your looks are determined by your genes. To some extent that, of course, is true. But to what extent? And more importantly, is it always the case? Out of all the health problems people encounter nowadays, perhaps one of the least apparent, yet at the same time potentially most harmful and pretty common, is mouth breathing. Of course, you've probably already heard it as a joke, a meme, or even an insult, but any joke is always originally based on a story. So what's the story behind this one? In this video, we will explain why it is bad, how to prevent it, and how to avert some of the damage it causes. First of all, let's make a few things clear. Is it always bad to breathe through your mouth? As we all know, breathing provides our bodies with the oxygen we need for survival, while at the same time it also lets you release carbon dioxide and other waste. There are two ways air can reach our lungs and get out of them, the nose and the mouth. Normally people can use both their nose and their mouth to breathe depending on the particular situation. Usually, mouth breathing is only needed when we have nasal congestion due to allergies or a cold. Aside from that, whenever we exercise intensely or stress our body physically in some way, mouth breathing can also help get oxygen to our muscles faster. However, breathing through the mouth all the time, especially when you're asleep, can lead to certain problems. Let's go through some of them. Problem number 1. It affects the way your face looks. It was only recently that we've begun to discover the significant role our tongues play in the formation of our face and teeth. Ideally, the tongue is supposed to rest on the palate of your mouth in a spherical shape and with lips sealed shut. This simple habit is often instinctual, as breastfeeding normally encourages this posture in us from birth. This habit is also what helps the development of our skulls and alignment of our teeth. However, in the case of mouth breathing and bad neck posture, the tongue is not resting in its proper place, making it impossible for both the skull and teeth to form correctly. Therefore, if a child fails to adopt correct tongue and spinal posture for long periods of time, it can take a serious toll on their looks. This can often result in the child having crooked teeth or an underbite or an overbite. For parents, this means spending lots of money on dental appliances like braces only for the teeth to go back to the incorrect position. That's because moving teeth into the right placement with appliances means nothing if the person continues to take part in mouth breathing and incorrect posture. Aside from that, many people complain about their lack of cheekbones or their recessed face and blame genetics, but in reality, these issues normally have nothing to do with genes. Instead, they can be entirely determined and controlled by your tongue. It is important to note that mouth breathing can often result in sleep apnea, which can further worsen the damage done. For example, not getting enough quality sleep or spending too much time in the REM stage makes it difficult for your body to properly heal and grow, as our sleep is when these crucial processes take place. Therefore, prolonged constant disruption of sleep will ultimately screw you up very badly. Besides, it causes other problems to one's physical state, such as speech and pronunciation issues due to a weak tongue, an abnormal shape of the teeth and jaws, and flawed spinal posture. But probably the biggest problem of all is that it's also been discovered to cause problems to our brain development. Aside from potentially leading to sleep apnea, it can also decrease your cognitive abilities, making you feel always tired and lazy, which will greatly affect any person's life in the most dramatic ways. This means bad grades for kids and teenagers, and less efficiency at work for adults, sometimes also leading to depression and apathy due to always being sleepy and never feeling rested enough. Most surprising, though, are the ADHD symptoms this issue can cause. In a child, ADHD is often described as fidgeting, impulsivity, inability to focus, and bad behavior. However, these symptoms are exactly what you'd expect from a child with prolonged sleep deprivation.
Children with obstructive sleep apnea are fidgeting and unable to stay on task because they're doing anything they can to stay awake,
says Dr. Chung, a professor at Asan Medical Center in South Korea. So fellow parents or peers of someone suffering from ADHD, ask yourself a question: do they really suffer from this disorder, or are they perhaps not receiving the crucial amount of quality sleep that they require every night? Even if you make sure your child receives 10 hours of shut-eye a night or more, the amount of sleep ultimately means nothing if the quality is severely lacking, not allowing the body to properly rest, grow, and heal. You may easily never realize that you are actually one of the mouth breathers, especially if it only happens in your sleep. The symptoms potentially indicating that you have this problem are snoring, dry mouth, bad breath, often waking up tired and in a bad mood, chronic fatigue, a foggy, unfocused mind, and dark circles under your eyes. Yes, that's right, the dark circles you seem to always have despite sleeping 8+ hours every day could very well mean that you're a mouth breather. The fact that mouth breathing is very drying is worth a special mention. A dry mouth means that saliva cannot wash bacteria from the mouth. Aside from bad breath, this can lead to tooth cavities as well as throat and ear infections. Mouth breathing may also result in low oxygen concentration in the blood. This is associated with high blood pressure and heart failure. Studies show that breathing may also decrease lung function and worsen symptoms in people with asthma. It is especially important for parents to inspect their children for signs of mouth breathing. Naturally, with this being difficult even for adults to notice in themselves, it is even harder for a kid to realize that something's wrong. Much like adults, children in this case will breathe with their mouth open and snore at night. Those kids who breathe through their mouths for most of the day may also have the following symptoms: slower than normal growth rate, irritability, increased crying episodes at night, enlarged tonsils, dry and cracked lips, problem concentrating at school, and daytime sleepiness. Sadly, as we already discussed before, children who exhibit problems concentrating at school are often misdiagnosed with ADHD instead of being treated for their sleep, which is usually the root cause of these issues. So what are the usual causes of mouth breathing? The underlying cause of most cases of mouth breathing is a completely or partially blocked nasal airway. In other words, there is something preventing the smooth passage of air into the nose. If your nose is blocked, the body automatically resorts to the only other source that can provide oxygen, your mouth. There are many possible causes of a blocked nose. These include nasal congestion caused by allergies, a cold, or a sinus infection, enlarged adenoids, enlarged tonsils, a deviated septum, and many more. Some people develop a habit of breathing through their mouth instead of their nose even after the nasal obstruction clears. For some people with sleep apnea, it may become a habit to sleep with their mouth open to accommodate their need for oxygen. Fortunately, these issues are nothing that cannot be fixed, especially with modern medical advancements. The next logical question is, how is mouth breathing to be treated? It is very important to visit a doctor if you have trouble breathing through your nose. Together, you will be able to figure out the cause of it and ways to deal with the issue. A common over-the-counter treatment is an adhesive strip applied to the bridge of the nose. This strip decreases airflow resistance and helps you breathe more easily through your nose. If you have obstructive sleep apnea, your doctor will likely have you wear a face mask appliance at night called CPAP, Continuous Positive Air Pressure Therapy. Such an appliance delivers air to your nose and mouth through a mask. The pressure of the air keeps your airway from collapsing and becoming blocked, allowing you to breathe properly throughout the night and get high-quality sleep. In children, the surgical removal of swollen tonsils and adenoids may be advised by a doctor and will make breathing easier for the child. A dentist might also recommend that your child wears an appliance designed to widen the palate and help open the sinuses and nasal passages. However, for reasons discussed above, it is best to visit a doctor who would help your child with their tongue posture, thus allowing them to widen their palate naturally and permanently using their tongue, without the need for any appliances. And now that you know all the negative sides of it, the only thing that remains is to answer the question, how to prevent mouth breathing. If you have recognized in yourself some symptoms of mouth breathing, do not worry, because there are many steps you can take to prevent them in the future. For example, you should try using nasal sprays and/or allergy reliever medications at the first sign of allergy or cold symptoms, keeping your house clean and free of allergens, and consciously practicing breathing through your nose throughout the day. And if you struggle to breathe through your nose at night, it is recommended to try out different sleeping positions to see which one would open your nasal passage more and make breathing more comfortable. The most ideal position for opening your nasal passageways is sleeping on your back with your head slightly elevated. If you're experiencing stress or anxiety, it may also help to engage in yoga or meditation. which are both practices that promote nasal breathing and awareness of your breaths. And if you still remain unconvinced, let's go through the brief summary of pros and cons of preventing mouth breathing in total. Treating mouth breathing in children early can reduce or prevent the negative effect on facial and dental development. Therefore, it is very important to try and prevent mouth breathing as soon as possible, as around 90% of the face and body stops growing by approximately age 17. After this point, any damage done will be very difficult to reverse naturally and is likely to require surgery. Children who receive surgery or other intervention to reduce mouth breathing show improvement in energy levels, behavior, academic performance, and growth. Even without such statistics, it is obviously very important to adjust to breathing the way nature intended for us to, with the nose for breathing and the mouth for eating. Any other way is beneficial in no way whatsoever. And this is all we have to say for today. If you enjoyed the video and find it useful, please don't forget to click the like button, share it with your friends, and of course subscribe to our channel if you want to get more interesting videos like this in the future. Thanks for watching and see you next time.